to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordan Comstock and Mr. Ben Tuine. This podcast is sponsored by BoomCloud Dental Membership Software, www.boomcloudapps.com, and Veritas Dental Resources, www.veritasdentalresources.com. Enjoy the show.
Welcome to another exciting episode of our Say No to PPOs podcast series. This is Ben Tuine. Got my co-host Jordan Comstock. Jordan, how's it going?
Yo, Ben, I'm doing awesome, man. Life is good. I'm excited for another awesome episode today.
Rock on, man.
Yeah, rock on.
We keep talking about the weather, so we might want to continue this episode. So I was in Florida last week.
Oh, yeah, you lucky.
In Orlando. It was 95 degrees. It was summertime the first 3 days, and then the last 3 days ended off in the mid-70s. Saturday night, when we fly home, as we're descending into Salt Lake City, it's a blizzard out there. It is snowing. We pass over your house, and it was just snowing. It was whiteout conditions, and we had to get an Uber on the way back. So we got a bigger Uber on the way back, and this poor kid, man, I gave him 5 stars, but this poor kid, he almost ran into barricades and
driving in the snow.
He was sweating, like his face was just drenched. I felt so bad for him because I know how it is driving in the snow and being responsible for all the lives that you have in your car. But fortunately, he got us home safely, which was great.
Yeah, I don't like, if I were to do Uber, if I needed to do Uber like as a job, I don't think I would be a good one because the other day, apparently I don't know how to use my brakes, but I crashed into a back.
Did you really, dude?
And, yeah, it's not bad at all. It was like a little bumper. Like I looked at it, I'm like, oh really? It did nothing to the truck, but my car it bent it up a little bit. So I'm like, man, I suck at driving. It's either that. So that's why I'm not an Uber driver, and it's either that or I get a lot of speeding tickets.
Yeah. So there are cars now that have technology. There's Subaru, BMW, Mercedes has the same technology. There are other cars, I don't know the brands, but I know the Subaru. If you're driving and it has the auto stop, it'll slow down automatically. It'll slam on the brakes. My car does that for me. Like if I'm not paying attention.
Yeah, see that's what I need, man. I need a car that stops for me and a car that makes me so I don't speed.
Yeah. I'll show you. There are several cars out there that can do that for you. But the younger generation is going to need that because you see so many people texting on the road. So
definitely.
So if you're listening to this in the car, please don't text and drive. Drive safely.
Yeah, do that.
So today we have an exciting guest. We have a good friend of ours who I met, Dr. Jason Campbell in Arizona 2 years ago. He is part of the Dental Success Institute run by Dr. Mark Costas. When I met Dr. Campbell back then, he did speak about his area of focus, which is something that we're going to elaborate more on today. He refers to it as biofunctional disorder. And in my history of interviewing and talking to dentists and front office team members and specialists all across the country, I think you're the same, Jordan. I've never found anybody or met anybody in dentistry that does what Dr. Campbell does.
No, and in fact, when we were talking to him, you know, I'm like, wow, I've never even heard about this, and I at least have some experience on the clinical side, being a part of the lab years ago. I never even heard about it, but maybe I just was more focused on trying to grow the lab and do all that stuff. But yeah, it's very interesting what he's about to talk about with us. It's very cool. I was fascinated.
Yeah. So this is going to be an hour-long episode for those of you that are listening, just if you want to time things out. But this is going to be more clinically based, and we're going to talk a little bit about how to bill insurance if we have time. But I highly recommend that you tune into this one. This is going to be an exciting episode. And without further ado, let's get going. Folks, we have another exciting guest with us today, our good friend Jason Campbell in Prescott, Arizona. Do they pronounce it Prescott or Prescott where you're at?
Well, if you're an outsider, you pronounce it Prescott. And if you're an insider, you pronounce it Prescott.
Okay, we'll say
Oh,
Prescott.
wow. I'm definitely an outsider because I've messed that name up.
Tomato,
Well,
tomato, you know?
Yeah.
we can correct that and make you an official insider from this point forward.
Okay, so Dr. Jason
Nice.
Campbell from Prescott, Arizona. He's with
Yeah.
us. You know, Dr. Campbell, I took an oral sedation, an oral conscious sedation class back in 2018. I took it alongside with about 15 general dentists, and it was interesting when I sat through that 3-day class. It was 8 hours each day for 3 days. I learned something about the different opportunities in dentistry. I learned from that course that there was definitely a segment of the market that's sedation related, and some offices have really built that up extensively and used the fear of dentistry to their advantage to build a unique patient base. For instance, one of these practices was in Toronto, and most of their patients came from Europe, from ways away to get and spend $80,000 in 8 hours to get all the dental treatment that they need. So there's these areas of untapped markets that we see, and I think yours is one area of an untapped market within dentistry that I think a lot of people don't figure out, don't realize, or may have a fear of even getting into because of the fear of insurance denial or lack of reimbursement or other issues. So this untapped market of biofunctional disorder, which is what we're going to talk about today. Before we get into that, Dr. Campbell, can you, just for the sake of our listeners, because we know who you are, Dr. Campbell spoke at the Dental Success Institute Summit a couple of weeks ago, and I met him for the first time 2 years ago when I spoke at that meeting as well. Awesome information about your talk on this most recent one where you focus on the extinction of the fee-for-service office and fight for the solo practitioners. So some of the things that we're trying to advocate for on behalf of the solo practitioner. Can you give our listeners some background about who you are, where you practice, and what you're up to these days in dentistry?
Absolutely. You know, believe it or not, this is an area of care that I've kind of fallen into by accident, and it's become something that's worked very well for us. And there's no magic pill to it, to be honest with you, Ben. You know, one of the things you commented on was finding these areas, these new, you know, I hate to use the word niche. What I really like to use is the term differentiation, because I think that's what we're all trying to do. You know, we're all working in the same market, and we're trying to find a way to either make ourselves stand out for ourselves, for our staff, for our patients, but even more importantly, to stand out in the community so that as people are reaching out, looking for a solution to their health care, something that brings you to their attention and driving patients to your practice. And I've got to be honest with you, we've tapped into something that I think is the blue ocean.
Nice.
Yeah, I like that.
We hear that term.
I'm guessing you read that book, right, Doctor?
Yeah, you know, I hear that
Blue Ocean Strategy.
Yeah, I hear that term being used frequently, and the way that I've described what we're doing right now as far as the impact that it makes for our practice and our outreach to the community is, I think back, I took my wife on vacation with some friends to Cancun. Have you guys ever been there?
Yeah.
I saw it in National Geographic once.
Yeah. Well, there's this high adventure area where you can go do this tubing through these caves that are underground, and you're in the water. And you know, I kind of thought about, as dentists, I feel like we're all packed in like the group that we were in these small tunnels, you know, and we're fighting for space and we're fighting for air. And I happened to be at the front of the pack with my wife, and there was this one area where we came into this big cavern, and I was the first one into that area. And I thought, oh, this is so nice to kind of break away and have all this room and space. And that's kind of what biofunction has done. And I know that's a term that's not common to people. In fact, we've recognized that there's a category of individual who suffer from a myriad of events that end up creating severe dental problems, either dental demise or terminal dentition. And what I noticed with these patients is they all shared common symptoms or side effects of the problems, and they were all in active care. I mean, a lot of them were. Some of those individuals had become kind of like dental and medical refugees, where they've fallen out of care. They've become so discouraged that, they don't feel like there's any hope for them. They feel like they were born with bad teeth. And, I just have a hard time accepting that, because I think any teeth are good teeth, even if they're, minerally soft. Who cares? If you could control the elements that are causing the problems, you can help them keep those teeth healthy and help them keep them for life. And so I just refuse to buy into this, oh, I was born with bad teeth.
Interesting.
Yeah.
So doctor, who can you educate our audience, like, who is the biofunctional disorder patient?
All right. What it amounts to, Jordan, is this. In dentistry, we're really fighting three elements. And if you could control those three elements, you could stop 99% of all dental problems. And up front, people may want to argue with me about this point, but if you look at it in detail, you'll find it's true. So the first issue that people really struggle with that create a lot of dental problems is issues of biomechanics. Jaw mechanics and force distribution problems. So the forces being generated on the teeth by musculature is either going to be in harmony or it's going to create deterioration. It's kind of like having the front end of your car out of alignment.
Okay.
Yeah, there's different stages of that. In a mild case, maybe you're getting premature tire wear, or in a more severe case, maybe your steering wheel is shaking as you're going down the road. Well, people suffer with these certain elements of biomechanics and the forces that are being destructive in their mouths. Okay.
Yeah.
So that's element number one. How do we control the forces that are causing tooth and restoration deterioration? The second element is acid. Acid is what promotes tooth decay. Acid is what breaks down our dental materials and causes premature failure. It causes issues in the tissue. And so if we could control acid, we could stop tooth decay altogether. And the third element is inflammation, which we know is the ultimate cause for periodontal disease, periodontal bone loss, tissue degeneration. It's what creates peri-implantitis. So if you take these events and you start to try to manage those, if we were 100% successful in controlling those three things, people would have very few dental issues outside of trauma or random events. Would you guys agree with that?
Yeah. I'm thinking about my son. My son was a premature baby, 24-weeker. It's funny because when you read all the articles about premature babies, especially between age 24 weeks gestation and 30 weeks gestation, the one common theme that I found is that they're not going to have great teeth throughout their life. They're going to have poor teeth.
Interesting.
Yeah, and thinking about it now, my wife, my son eats better than me, and he's setting an example for me to eat my vegetables.
Nice.
I gotta eat my greens.
You still don't eat your vegetables, huh, Dad?
No, I eat the cows that I eat a lot of vegetables, so I don't eat a lot of vegetables because of that. So
that sounds like me, man.
At least it's grass-fed.
Yeah. No, but the funny thing is that I'm not a dentist, but this makes a lot of sense to me, just the logic behind it, because my son he eats healthy, and he's 6 years old. Coming from where I come from in the islands, when I was 6 years old, I had so many cavities on my baby teeth, and I brushed every day, or I thought I brushed every day. But it seems to me that, like, even an older patient, a few who I know who are in their 50s that have all their natural teeth and have a filling from time to time. And I don't know if I'm going off topic here, but what you mentioned about the jaw mechanics, the acid, and the inflammation, it makes perfect sense. Question about this, because in looking at biofunctional disorder as the blue ocean strategy.
Yeah, I love it.
It's one area that I look, and with my business, I got into this business because I found out that it was a blue ocean or that space years after I got involved with this business. What led you, or at least what led your interest into getting into this type of dentistry, Dr. Campbell?
It's funny. I have so many doctors. The first question that Ben, that I have a learning institute. It's the Advanced Prosthetics Institute, where we hold courses to educate doctors on this. And one of the questions we get from doctors a lot is, so where did you learn this? Like, who's your mentor in this? And, it's funny, I'm a big self-learner. I do a lot of reading, and I rarely spend time reading material that's fluffy. I'm usually in the meat of stuff, and so all through dental school, I was reading Pinky and Dawson and all these occlusion books, and so I guess when it comes to force dynamics and biomechanics, I would say that Spears, Dawson, Pinky. I've looked at neuromuscular stuff with LVI. I have to go back to them as far as giving me a foundation for reconstruction.
Cool.
Right.
The bigger influence for me was that I suffer with most of the conditions that I'm speaking about. And, I'll give you an example. Genetically in my family, we have a gene for missing teeth. And so I got 20 permanent teeth.
Wow.
My daughter's getting 12 permanent teeth. My son, one of my twins is getting 13 permanent teeth. My daughter, I've already done 4 major surgeries, bone grafting, ridge augments, sinus lifts, implants, just to get her through the ortho phase, right?
Yeah.
Wow.
So having that background, then you couple that with, I've got a class 3 jaw relationship that was corrected orthodontically. So the biomechanics of the way my jaws worked were kind of a perfect recipe for problems over time. But then I had some other issues that were adding to that problem that ended up creating a lot of pain. I always suffered with jaw pain. I had chronic headaches, phantom facial pain, that kind of stuff. And what I learned over time is that I had some digestive problems that were causing systemic acidity and systemic inflammation. So here's a good example of a biofunctional disorder. Bio meaning biology, functional meaning functionality, where I had a dietary problem that increased acidity and inflammation typically throughout my body's tissues.
Right.
Then you take bad jaw mechanics that were inducing clenching, grinding, bruxism, right? Well, the end result of muscle abuse or muscle use is depletion of resources. And when you deplete your jaw muscles of glycogen, calcium, potassium, it starts to generate lactic acid, kind of as its last-ditch effort to get the energy that it needs for function. Well, what happens is when you combine systemic acid with lactic acid from clenching, grinding, bruxism, parafunctional habits, it just adds insult to injury. Right. So a lot of the effects that I was having were directly related to stuff that wasn't occurring in my mouth, but was occurring in other areas of my body that made me susceptible to these chronic conditions. And it wasn't until, when I was 27, I had a full mouth reconstruction done. And it helped me a lot to get through some of the jaw dynamics problem, but it didn't resolve everything. And it wasn't until much later in my life when I got on top of some of these other food issues and digestive problems that were causing the acidity and inflammation that I was really able to make headway in controlling it. So in my mind, I thought, all right, well, listen, if this is me, I'm seeing all of these patients with similar problems. I'm figuring out solutions for them. There must be some place where I can go to get education on this. And I looked and looked and looked. I've spent thousands of dollars trying to find training to just help with chronic facial pain. And, I've taken courses on, TMJ, on, bite correction, reconstruction, pain management, but nothing was ever tying these things together. And so I just started this endeavor of trying to figure it out because there were so many people that had this problem. And I felt responsible as a care provider to help them find a way to stop the contributing problems that were causing all of these issues. And the next challenge that kind of came along is I just noticed that all these people with these underlying problems, they all had the same symptoms.
Right.
High caries risk. Their caries index is very high. Risks for periodontal disease, but a lot of them were having receding gums without periodontal disease,
Wow.
abfraction at the gum line, enamel crazing, strong wear facets, a lot of tooth and restoration fractures, jaw pain, chronic headaches, but they also had like vitamin D, B12, B6 deficiencies. Most of them were suffering with general body achiness, joint issues, muscular problems. And a lot of them were chronically fatigued and not sleeping. And so
Wow.
there was this connection between what I was seeing with gastric acid issues and all of these other effects. Inflammation in the body creates a lot of problems. Hey Ben, were you at the Voices of Dentistry? Either one of you guys?
No, we missed
We wanted
it.
to go, but we
Yeah,
didn't make it.
we had
We didn't make it.
other things going that week, but we
You know,
did.
there was
Yeah.
It was really cool. Dr. Bradley Bell, a world-renowned cardiologist, was there talking about the effects of inflammation on cardiovascular disease. And really, he's narrowed down cardiovascular accidents to three things: high blood pressure, cholesterol, and arterial inflammation. And so acid and inflammation causes problems throughout the whole body. And we don't really recognize it in dentistry because we are more like tooth mechanics than we are diagnosticians and interventionists, right?
Yeah.
Right.
Uh-huh.
Well,
I can relate there. Yeah.
a lot of the effects are having really severe detrimental dental problems. And so it's hard for me to sit back knowing what I know now and just ignoring these people and offering them nothing. But it comes down to something as simple as this. You've got to be able to identify your patients. Sometimes I see patients with pure biomechanical problems. We treat it biomechanically, and that's it. We intervene early. We're using technology like T-scans, force dynamic assessments, and we're just figuring out where the problems are through equilibration, additive or subtractive dentistry. We can correct bites and just get everything settled down, right? So we can treat the biomechanical patient preventively. And then
Very
occasionally
interesting.
you see those patients where maybe the biomechanics is all right. You're not seeing abfraction, you're not seeing enamel crazing, you're not seeing wear facet, but you're seeing these pits in their teeth without an explanation for it. They're not drinking a lot of acidic products, or they're brushing, so the acid's not coming from bacteria in their mouth, but yet they're still having enamel meltdown. So you have these just pure acid patients that you contend with. Well, the third category is the patient who has biomechanical and force distribution problems coupled with high systemic acid and oral acids and inflammation, and it creates this perfect storm. It's like a hurricane storm system for these individuals. They deal with it most of their lives, and then by the time they reach me at 55, 60 years old, they're about ready to retire, and they're looking at a $50,000-$60,000 dental bill.
Wow.
Just if they want to keep their teeth moving forward, or we're doing implant reconstructions and really, really expensive for them later in life.
Yeah.
Right? So if you want to talk about the blue ocean, here's what I'm looking at. A lot of these people, biomechanically, how many times do you see kids coming out of orthodontics that are starting to develop abfraction at the gum line, receding gums without periodontal disease, enamel crazing, they're already having jaw pain? If you could just step in and just correct the force dynamics and biomechanic problem early, you could save them a lot of problems later in life, and it's very profitable in the process. If you treated every orthodontic patient with an equilibration afterwards, that's very profitable there.
Yeah.
Very interesting. So Dr. Campbell, what are the benefits to patient care?
I'm not quite following your question, Jordan.
Let's see. So,
or advantages to the patient?
yeah, what are the advantages of the patient? Obviously treating this, is the question that I'm interested in. Because I'm thinking of my wife. She's sounds like she has a lot of the things that you talked about, and I'm just kind of curious on the patient and what are the benefits of catching this and treating this early, and kind of explain the process there on the patient side.
Yeah. So here's the thing that's really remarkable. Have you guys ever been to like a Christian revival?
Oh yeah. A few times.
The person that, comes to the front and they're lame and they're in a wheelchair and the guy lays his hands on their chest and
Yep.
they get up and they walk and it's like a miraculous recovery.
Yeah.
Yeah.
That's the stuff that feels like in my practice.
Amen there. Amen, brother.
Amen, brother.
Literally, it's like a Christian revival every day because the stuff that we're doing, it's so miraculous in these people's lives, and the concepts are really quite simple. Let's take this for example. Do you guys deal with or contend with TMJ, treating TMJ or headaches, anything like that?
Like ourselves?
No, I don't.
I apologize. Not you personally, but you guys, are
Yeah.
you working with doctors who are attempting to treat that stuff?
Absolutely. Every day. Yes.
Yeah. Oh yeah. When I was working at the lab, we saw that all the time. And then my wife also has issues with TMJ and always has to get stuff done.
Okay, so here's the thing to kind of understand. This is an area in dentistry where like 90% of us really have no clue, what's going on there. How do we fix this? How do we help these people? And so most of the time they walk in your practice and you want to turn and run the other way.
Right.
And then you get, a small percentage of dentists out there that, have kind of weird thinking and don't mind tackling these problems. And we have these aha experiences. And here's what I've come to realize. When it comes to TMJ pain, 95% or maybe even greater of those problems are soft tissue issues. It's rare that I find a true joint derangement or capsular derangement. Almost inevitably, it's musculature. And it comes down to a couple of things. And these are going to be terms that, maybe don't make sense to you guys, but I think will make sense to your listeners. It comes down to the neuromuscular feedback loop, okay?
Okay.
And what I mean by that is when teeth touch, every time a tooth touches, it sends a signal to the brain to say, hey, I'm here. And if you keep banging around on me like that, I'm going to have problems. So can you please alter this jaw to work around me? And so you get these this feedback system of information going to the brain from the teeth, and from the brain to the muscles that control the jaw, and it's what we call the neuromuscular feedback loop, right? Well,
Interesting.
If you get disruptions in that, say you have interferences in your bite that are changing that signaling system from the brain to muscles, or you have interferences in the bite or compensations, you get this you get these interruptions in that feedback loop that the brain wants to contend with. It gets, so when that happens, you get an alteration of your bite. It's what we call a bite compensation, which changes the envelope of function.
Okay.
The key to treating jaw pain, headaches, chronic facial pain is to do two things. Quiet the neuromuscular feedback loop so you're not getting constant signals to the muscles to work these deficiencies out in the teeth by either clenching them to move teeth into more orthodontically neutral positions, or by grinding them to make them flat so you get better force distribution on the teeth. Because your muscles generate about 200 square foot-pounds of force, and that's got to be distributed somehow. Some of it goes to the jaw joints, but the rest of it gets distributed in the teeth. And at night, when you want to relax, if those signals are continuing, the brain gets tired of that, and it creates a scenario of clenching or grinding, or what we call bruxism, where people pathologically start putting a lot of excess force on the teeth to try to work out these issues. Does that make sense to you guys?
yeah.
As laymen?
Yeah.
So
I'm thinking of my own mouth right now because I've noticed over the years. I noticed small little things in my teeth, and I got one of my lower teeth. It's kind of slightly crooked, and I've noticed that I've just during the day I play with it and I kind of tap it with my top teeth, because it just feels weird in my mouth, and I've noticed over the years it's kind of moving. Is that kind of what you're talking about? That's kind of what came to my mind.
Absolutely. It's almost like a pee under the mattress effect.
Okay, yeah. So
these little nagging things that the brain's
yeah,
very aware of, and so what it does is it just kind of alters this signaling system from teeth to brain to jaw muscles, and then it creates an alignment issue. Okay, so here's the key to doctors that are listening. Quieting that feedback loop system, that information system, I call it the information highway. If you can quiet that by simply redistributing forces more evenly, getting teeth working against each other, working in harmony better, making the dental arches relate together better, getting the bite and joint positioning correctly. There's thousands and thousands of sensors that the brain works off to make all of this happen. And the end result of all that signaling is the envelope of function, the dimensions that the jaw works in. And when that's compensated, the body accounts for that. It's like, again, having the front end of your car out of alignment. You get it aligned and the wear and tear stops. Well, the same is true for the musculature. If you can quiet all of this, you can also create an environment where acid decreases in the musculature, inflammation decreases in the musculature. You add a few anti-inflammatory protocols, some muscle relaxant protocols, and now all of a sudden you've got this perfect recipe to start helping people with managing TMJ pain in those situations where it's a soft tissue problem. Yeah. So your question to me was, well, what does that mean for the patient? Okay, so if you stepped in and you were able to say to this patient, okay, here's what's causing it, here's how we're going to fix it. When everything is said and done, you will see this pain start to go away in a very, very quick manner, and it doesn't, TMJ treatment doesn't have to be this long, drawn out problem. The one nuance that gets tricky is if they have systemic acid issues, say there's dietary issues or food allergies, any kind of autoimmune disease that adds to acid and inflammation, it compounds that. And now you have to think about, well, how do I quiet the jaw muscles, but how do I also control the acid coming from other areas?
Interesting. I got a question for you. This is kind of me thinking again about my own mouth. Yeah. I feel like I have more acid in my mouth over the past couple of years because I get a bunch of cankers. I don't know if that's a sign, but I get like ginormous cankers where I have to go to my doctor, and say, "Give me that whole bottle of Debacterol because this thing is freaking painful, and I got to get it out of my mouth." So is that, when you talk about acidity, is that like for me in my case? Could that potentially be, a problem in my own, system, affecting my mouth? Is all the acidity? I don't know if it's a dietary thing, which I can imagine it could be because I eat lots of candy.
Yeah. So I want to be careful not to make a blanket statement, Jordan.
Yeah.
Yes, if you have acid problems, that one of the side effects is going to be canker sores. But it definitely has to be, in a differential diagnosis, it has to be one of the things that I consider, but I'd be looking for other clinical evidences.
Okay.
What are your decay patterns looking like? Is this decay coming from bacteria? Is this decay coming from an acidic diet? Or is this decay coming from systemic acidity problems? And they're very easy to distinguish them when you know what you're looking at.
Okay. Right. So you look at multiple of, different, I guess, criteria when you're analyzing a patient mouth. Very interesting.
Yeah, so for every patient that sits down, that's what I'm looking at. Okay, I've got a decay problem. Is this bacteria? Bacteria are going to hide out between the contacts of teeth. They're going to hide in the grooves of your teeth. So they're pretty predictable where it's a bacteria problem. Those cavities happen consistently in the same places. Mm-hmm. If it's dietary, you'll have an increased risk for tooth decay. But you usually see it on like the broad surfaces of teeth, and it's always a decay problem. Yeah. It leaves cavities, but when it comes to systemic or digestive acidity, that acid is so caustic that it actually eats the minerals out of your teeth faster than decay can develop. Wow. And we're looking at that in the mouth, and we're seeing these erosions, but we're not really quite sure. We're not making the link back to, or we're not asking ourselves, what's the common denominator here? What's causing this? Where the acid is so severe that it's eroding the teeth faster than tooth decay can even develop, right? And so I look at those three areas as part of my evaluation. Is this bacterial? Is this dietary? Is this a systemic acid that I'm contending with? But for doctors, the solution's really quite simple. And when it comes to oral acidity, some doctors are more astute. They're right on top of it, and they're looking for ways to help their patients keep their mouth neutralized in those protocols, right? But we're not jumping over to the other arena and saying, okay, well, how do I alkalize? If I've got a systemic acidity problem, are there protocols that I could use with my patients that can help them alkalize their system so that they don't have this general body acidity? And that's what we teach at our course, and the system that we've developed over time is how do we neutralize the oral environment? How do we alkalize the systemic environment? And by doing that, we can decrease the TMJ problems, the chronic facial pain, the chronic headaches. And we couple that then with interventive biomechanical treatment. Now we're in the realm of treating TMJ, and that's just one of the facets that we use in our treatment protocols. Is we're identifying these individuals, we're reaching out to them in the community. So let me just throw this out to you. And Ben, this might even be something that's really in your arena.
Sure.
If a doctor's wanting to market their practice, what are the typical ways that a doctor would do that?
Oh, gosh. Discounted cleanings, discounted services, gifts, goodies.
Telling the community how awesome we are.
Right.
Review protocols, right?
Yep.
Well, what if instead of marketing in the same category as all of the other guys in town, saying the same things about yourself that they're saying about themselves?
Yeah.
And it's all true. I think of the guys practicing in my community. They're amazing dentists. I mean, they're excellent at what they do. They've got good staff. They got good protocols. You know what I mean? And yet we're all trying to tell our patients the same thing. Oh, I'm better than that guy. In fact, if you come in, I'm going to look at his dental work and I'm going to throw it under the bus just to make sure that I look just a little bit better than him.
That's true. That's funny. That's kind of how the market. I get 50 postcards a month from dentists, and they say exactly the same thing.
All the articles.
Me too. Yeah.
All the articles in the newspaper read the same way. They all talk,
yeah, they do.
Yeah, we're all talking about the same preventive services. But what if now you thought, okay, I want to do more implants, or I want to do more crown and bridge, or I want to do more periodontal surgery, or I want to, whatever it is, do more comprehensive care, or I want to treat TMJ or chronic facial pain. Well, what if you had this category of patient that suffers with all of those needs, right?
Right.
Because they've got acidity and inflammation problems. So what we teach our doctors is, well, how do you market to patients to attract them? Now, all of a sudden, what you're writing in the newspaper is separate from anybody else around you. The articles that go out are talking about things nobody's talking about. What if your marketing now isn't to the general community, but you're marketing to gastroenterologists who are treating cysts?
Interesting.
Or what about massage therapists who are helping patients with jaw pain, or chiropractors, or physical therapists, or ear, nose, and throat doctors,
even psychologists, psychiatrists.
So here's what it comes down to. I know a vast majority of TMJ patients have acid problems, which means they also have dental problems. Right. And so now we've developed a whole marketing system that focuses on helping patients in a very small way. So here's one of the things that we run into to try to get this message out to people. First of all, we had to find a way to classify these individuals to even identify them. And there was no classification in all of dentistry. How do you classify somebody that's got biomechanic issues and acid issues that are creating all of these negative side effects of TMJ, chronic facial pain, headaches, high caries index, biomechanical breakdown of teeth? There's not a word to describe that. There is something in medicine that I know that they had to develop in order to classify patients with a myriad of symptoms like that. It's called fibromyalgia.
Yeah.
Okay. You know any doctor that'll talk to you about fibromyalgia?
I personally don't.
So, most allopathic doctors don't consider that a true diagnosis. Usually it's it's supporting medical, it's DOs and holistic doctors. Those are the people that are willing to talk about it. But that actually,
Interesting.
yeah, that was a diagnosis that came from an endocrinologist who recognized there's this category of people that all have these same symptoms, and we don't know how to help them because we don't even know what to call the problem, right?
Right.
So in dentistry, what I've had to do to be effective is I've had to define this category of patient, and we call it biofunctional disorder or a biofunctional patient, which is a key to my staff that says, okay, this person has biomechanical problems, this person has oral and systemic acidity and inflammation problems. We need to peel back all of the factors that are contributing and treat them one at a time in a preventive, but even more importantly, in an interventive way. So now we've just added another element, a third dimension to what we do. Now we're interventional dentists, not just preventive and reactive dentists.
Right. I really like this. I'm taking so many notes here. And before you even mentioned where you market to, I wrote down gastrointestinal, psychological, pain doctors, and I'm thinking to myself on how I market. You go to places that your competitors don't market to get the referrals, but I can't help but put my insurance hat on, thinking along the lines of dental insurance. And the next statement here for anybody that works on a licensing board, I'm not speaking on behalf of what Dr. Campbell is solving with these patients, but it sounds a lot like to me that you are solving some gastrointestinal issues to a certain extent. You are solving some pain issues to a certain extent, and even psychological issues to a certain extent, as well as the TMJ and dental facial issues, all from a dental perspective. And looking at this from an insurance perspective, how does this fit in a PPO practice? Now, I know your practice is primarily fee-for-service, but how do you fit that into a PPO practice where most doctors are in-network? It's tough enough to even bill implants to insurance where implant services aren't recognized, and same thing with sleep dentistry. The sleep dentistry you can't bill to dental insurance. It's not part of the scope of dental coverage. And what you're describing here, since you've been so successful, I thought maybe you'd share some insight on how this works for you in your fee-for-service office, and perhaps how this could relate to a PPO office.
Yeah. So keep in mind, we do accept insurance, so that's something that we work with. Most patients see us out of network. I am a Delta Premier provider, which doesn't seem to carry much weight anymore with Delta's new policies and stuff, but let's just take this patient, for example. You have a patient come in your case workup. When you see that patient for the first time, all doctors everywhere are fighting tooth decay and gum disease. A small percentage of doctors are treating biomechanical issues, force distribution problems, right?
Mm-hmm. Right.
And no doctors are helping their patients with these underlying other contributors of acid and inflammation. So let's say we just take those first three. With every case workup now, we're identifying dental problems associated with tooth decay and gum disease, and we've added the third element of biomechanics. So let's generate a care plan. What do we do with this patient? The first thing that we do is, one, identify it, make sure they're aware that this is causing them problems and future problems. We would bring them back for an analysis. Now, most insurances are not really reimbursing for the analysis, so we keep our cost low. But it's a fee-for-service item in a PPO practice where these individuals are highly motivated to move forward with care because you've done a couple things. One, you've identified the source of most of their tooth decay problems, which no doctor's done yet. Um, and you've given them protocols to help stop the problem moving forward. So now their trust is, all right, doc, I get what you're saying. This makes sense. Thank you. You're telling me things I've never heard. Now they're your patient for life.
Right.
So now they're ready to accept your recommendations on how to get better. So we would start off with a bite analysis. We use a digital dynamics analysis system called a T-scan. It's made by a company called TechScan, where we read the force dynamics of their teeth interactions in association with their jaw muscles. Really simple. The software's amazing. The sensor's very accurate. So that's the first thing that we do, and then we'd come up with a diagnosis. In order to correct this, are we going to use subtractive dentistry and equilibrate? Are we going to use additive dentistry? Do we need to establish anterior guidance or canine rise? Right?
Right.
Mm-hmm.
Is there any kind of periodontal defects that need surgery? If a doctor is doing any kind of connective tissue grafting, now instead of just doing gum line fillings, you've just beefed up your surgery practice, where you can do, connective tissue grafts, reinforce the tissue, bring the gum line back down. Maybe you don't get enough recovery. Now you're coming back after the gum surgery's done, and you're doing some resurfacing with some class 5 composites, right?
Right.
You've scheduled your patient now for an equilibration. Maybe on that equilibration you can't get anterior guidance in the canines or canine rise, so you're now doing some additive dentistry to the linguals of the canines so that you can engage those canines when they're in movement quicker. And then you're introducing splint therapy to control what their jaw's doing while they're sleeping. So from a preventive standpoint, if you're thinking about maximizing the dollar that the patient's going to spend in your practice, instead of just like looking at them going, oh, you need a bunch of class 5 fillings that, by the way, are going to fall off in about 3 months because the acid in your mouth is going to break down the chemical bond, and the flexure on the teeth from your biomechanic is going to pop them off. And you're going to come in, and I'm going to want to charge you again, and you're going to want me to pay for it. So you're going to get mad at me, and I'm going to become a bad guy, and then you're going to go tell all of your friends in social media what a crappy job we do. Right?
It happens.
Yeah. It definitely happens.
Or you treat the patient comprehensively. You give them the knowledge that success is available if they just follow a few protocols. So now we're talking about nutritional counseling. So one of the things that we've done, Ben and Jordan, is over the years, we've created a system. We call it biofunctional practice system. For our course attendees, that's something that they can have access to, which is all of our marketing materials, all of our PowerPoint presentations where we do community seminars, where we educate our physicians. It gives all of our in-office protocols, like our, how to manage oral acidities, how to alkali systemic problems. And these are things that I've developed with other healthcare providers, with our gastroenterologists, nutritional counselors. We've developed these protocols that really amazingly work, and most of them are natural. It hardly costs the patient anything, but you can bill out for the nutritional counseling, right? So you've just added probably $2,000 to $6,000 to a care plan that probably would have looked like $1,200 to $1,400. Yep. You've set yourself up for success. Your patient thinks that you're amazing because not only are you helping them protect your teeth, but the chronic fatigue that they've experienced is starting to subside or decrease. With our protocols, we work on the deficiencies. I work with a cardiologist in town who has the ability to draw blood and run blood tests for our patients. We can identify absorption deficiencies in vitamin D and vitamin B6, B12, some of these needed elements for health. So we carry a supplementation line in our practice, and we educate our doctors on how to do that, and even use blood banks on how to get, some blood work done so they can identify where their patients are deficient. You need D, you need B12, you need B6. Those are all needed for tissue development. You know, sometimes if muscles are depleted, calcium and potassium, you can put your TMJ patients on those supplements, which will help the muscles recover quicker, decrease the acidity. I mean, it's this building block. And anyways, we've packaged that all up and we've made a system. So let me imagine for a minute, you guys are dentists. And
okay.
I'm talking to you about this and you're thinking, well, how in the world am I going to go back on Monday and implement any of this? It's all so complicated. And I'm saying, you know what, Doc? I've spent probably $650,000 over the last 5 years in development and marketing and putting all this together, paying for all of it. And we're saying, here you go, you know, come and learn how to do it. And by the way, here's your practice system to go back with, which you can access online and have access to our forum. And if you have questions, I have support staff to help you go back and implement it. If your staff has questions about how to get this thing rolling or how to bill it out, my staff's there to answer questions. You know, we have our forum now. So now all of a sudden we're taking this thing that seems kind of complex and you could look at it and you go, all right, well, how do I use this to increase profitability? Well, if you want to do more implants or you want to do more, you know, fillings, if you want to treat TMJ or chronic facial pain, you now have a system to draw these people into your practice and do whatever kind of dentistry you want to do, and whatever you don't want to do, find somebody to refer to. And so it's not super complicated stuff. Most insurances are participating with equilibrations. Most will participate with orthotics. It's not rocket science. And I'll be honest with you, the reason that I really focus in this area is because I'm a surgical reconstructive dentist. That's where I find my joy. I don't know why. I have one of those sick minds that, you know, likes that stuff, but that's why. You know, I treat these other things so I can get to the stuff that I really enjoy in dentistry. But at the same time, I think the bottom line, what I like the most about what I do, and it's the question that you asked me, and I know that this is a long-winded answer.
No, you're fine.
No, you're totally fine.
The bottom line is, it is so incredible for me and my staff to watch these people go through this transition and come back and say, hey, by the way, I can't believe that protocol is working the way it is, but I had this other thing going on that's gone now.
Wow.
Or the headaches that I've suffered with every other day for my whole life are now gone. And I say that, I know, and it's hard to imagine that it could be that simple, but it's that simple.
It's awesome.
If you could take the contributors away, the symptoms go away too in most cases.
You know, I look at this like
Awesome.
One of the vehicles that I have, if you use the wrong battery, if you're not using the manufacturer's battery, the vehicle won't work properly. And it's just one small, simple thing. And I remember when I bought the car, somebody else put in a different battery. And then all of a sudden, a few key functions and sensors stopped working, although the battery is very healthy. But once I replaced it, everything in the car that I didn't know exists started to work properly. And it was just as simple as using the right thing, a very simple process to get all the systems to work. And that's what I'm thinking about when I'm looking at this. Like, I'm trying to look at this from an insurance perspective on how to bill all this to insurance. And I think you addressed that. Yeah. But what you're talking about is
your doctors are already doing it.
Yeah, they are. That's right.
Now their understanding goes deeper. They're recognizing the sources of the problems, and they're making recommendations to get people healthy, not just become tooth mechanics and putting stuff in that's really going to break down anyways. It's going to fail prematurely, and you always look bad with these individuals if you don't address the causes. And so it's a plus in all areas of care. It's just recognizing it and having just the protocols to say, okay, when you see this patient, here's what happens, guys. Here's what the staff does. Here's what we recommend. And it becomes like clockwork, like any other system in your practice, when you know what you're seeing and you know how to address it. It becomes super empowering to our dentists. And I think that's our focus, is how do we there's only one of me doing this in this care approach. There's thousands and thousands of patients in every community that have the problem that's going unaddressed. And in my mind, I'm thinking, okay, there definitely needs to be more than one doctor in the nation who's
Yeah.
people's problems this way.
That's a lot of patience. That's a lot of patience.
Well, you're the first that I've heard do this type of work. I honestly haven't heard anybody else. And I think Jordan and I speak to a lot of dentists, and most most are into like the OBI, like the implants, for instance, or the TMJ or the sleep apnea issues. I honestly can't say I've met anybody that does biofunctional disorder or anybody else's version of that phrase, that term. So I think
I looked for years to find my own education, and I unfortunately personal experience with patients and the school of hard knocks is what really got us to where we could really make an impact for people. But I'm an open book. The people that I work with are open books. I know you guys are. You're out there sharing information. Other podcasters, the same thing. We're really looking for ways to make each other better in what we're doing.
Absolutely.
And what we are just simply offering, if you look at the tuition on our courses, basically like giving this stuff away to doctors, saying, listen, just come and take the class and go do this stuff with your existing patient base. Because here's the way I look at it. I think any dental practice, if you have a patient base of 1,700 patients, let's say, my estimate is that there's probably $300,000 to $400,000 of preventive care still in your practice, just waiting for you to tap into, just with your existing patient base. Not to mention what our marketing plan could do. Let me share this with you. This is how it worked in my practice. With our total marketing system and the way we had laid that out, we were probably working about 30% of its capacity. And in that first year, I had to bring on an associate, and we doubled our practice production just within our own patient base.
Wow.
Right? And it was like this crazy event, and we're kind of got to the point where we're maxing our capacity again, but I'm limited by space. I either have to get into a bigger facility or, look at multiple practice options.
That's a good problem. It's a good problem to have.
Yeah, right. Yeah, seriously. It's that blue ocean event where it's just looking at things a little bit differently, So here's an example. You talk about dental implants, which seems to be how dentists are really trying to differentiate themselves right now. Those guys who can and who can't.
Right.
Mm-hmm.
Right. Well, in the population of doctors who can, not all of them can do implants, and not all of them can site prepare in order to place implants. Okay, we're placing implants in prepared sites, but we're referring out the stuff that needs site preparation because it's a little more complicated, right?
Mm-hmm.
So there's not a lot of complexity, and here's what I think is happening in the world of implantology is there's a lot of courses available. A lot of them are weekend courses, and most of them are being subsidized by implant companies. Well, what is their focus? If it's being sponsored by an implant company, they are trying to get doctors to place their system, and so you learn how to place the implant system. You're not learning surgery. Well, surgery, yes, implants are the result of surgical knowledge, not vice versa. Implants give you surgical knowledge. And so one of the things that we've added to our curriculum is a course based in surgical principles so that doctors can place implants, site preparation, how to manage complications. You learn implant systems, but I'm a doctor working with patients, and we are trying to help them understand surgery so that no matter what situation they're in, they can logically think their way through the principles of surgery to get the end result that they need, instead of compromising their prosthetic outcome by downsizing an implant or You know what I mean? That's what's happening a lot now. So we
Yeah.
see a lot of failures coming from general dentists because the courses that we're taking, they're really not teaching us surgery unless you're going to like a big maxi course that's going to take you a year to get through. So what I've done is I've taken all those surgical principles from years and years of education. We've condensed it into one course that really, really emphasizes surgical principles with implants as the end result or grafting as the end result. But it's all the stuff around the implants that really matters for you, for your patients, for the outcome of your cases, for their longevity. So that's just one other area that we add to doctors' end result is you're going to get these patients with complex care needs. Well, if you want to do implants, well, you've got to understand how to do surgery. If you want to do gum grafting, you got to understand principles of surgery. And once you learn those basic principles, it crosses over. The next thing you do, you're doing wisdom teeth, which you weren't doing before and referring out, or you know what I mean? So it just adds to your bag of tricks when your focus is right.
So I know, Doctor, you've got a couple of cool, really interesting courses that I think our audience will, like to learn more about. Where can they find more information about your courses?
I'll tell you what, there's a couple things. First of all, I would say that our website is a great resource. They can go to advancedprostheticsinstitute.com. A lot of information there. And one of the things that we're offering for your guys' listeners is something called the Blueprint to Becoming a Dental Black Belt.
I like that.
Where we've outlined, this care approach to take your practice from where it's at to making it really thrive. And so they can download that there and use that as kind of a teaser for what we're doing. But the course information's at the website as well.
And that's www.advancedprostheticsinstitute.com, correct? Where they can find that?
We do have a couple of courses coming up. We've got a surgical course. The name of it is a biofunctional approach from implant placement to restoration. That's August 3rd through the 5th. Seats are limited. We only take 11 doctors for that course.
Oh, wow.
Yep. And then in September, the 15th through the 16th, there's a 2-day course, a system-based care approach to treating biofunctional disorders and dental medical issues, where we really break down the stuff that we've talked about today, give the protocols to use with your patients from day one, and then give resources and access to the tools to really implement that stuff day to day in your practice.
Yeah, I really like this. We're going to post this information in the show notes. What you went through today, I'm taking all these notes, and I always forget that we record these things. I can go back and listen to it. Although I'm not a dentist, what I'm thinking
it's definitely interesting.
Yeah, is that you're more than a dentist. You're more than just somebody that goes in and does crown and bridge work. You do something that I've never heard of, that's even available in the dental industry. And I'm thinking about perhaps even becoming a patient, and several other people that I know that suffer from the issues that you covered that have not been able to get anything close to what you're talking about. After seeing specialists, dental specialists, medical specialists, there just doesn't seem to be a solution for a lot of these things that you discussed at a one-stop shop. So we really appreciate you sharing this with us today. Do you have any closing thoughts or final thoughts that you want to leave with our listeners before we let you go this evening?
Yeah, there's two things that typically happen in a dental practice: prevention and reactive care. And unfortunately, the business models of dentistry end up leaving us to become tooth mechanics more than healthcare providers, right? We're taking these problems after they happen.
Absolutely. I mean, I saw that quite a bit in the lab. We always would talk about the doctors being the tooth mechanics. that same word too.
And so our invitation to our practitioners is to say there's something more. You can become an interventionist as well as a preventive care provider, and it becomes a very empowering thing to your practice. Our focus in dentistry should be to keep that patient out of your chair. And when your emphasis is that, the marketing takes care of itself, right? Because patients become appreciative of that. Our job is to intervene when our preventive and our interventive care programs fail or patients fail to follow them. And then we should be there to assist patients to recovery, whatever that is, getting them teeth back in their mouth so that they have, good mechanics, so that they have healthy jaws, healthy muscles, restoring their teeth when they have problems. But again, we should, once that's done, go back to prevention and intervention and really try to help our patients avoid those problems. And that's our mandate. That's my message to any of your listeners or anybody who's ever willing to listen to what we have to say is, we have the opportunity to really make a difference and not just pretend to talk about helping people avoid problems, but really getting to the bottom of them, nipping them in the bud early. 80% of what we do is preventive and interventive, and then 20% is surgical and reconstructive. But once we've had patients in our practice, we want them cycling through our ReCare program because that leaves me available to help those patients, the next cycle of patients coming through with bigger problems and doing the dentistry that I like to do.
Yeah.
Awesome.
I can only imagine that some of the people listening that do run study clubs and associations that they would love to hear more from you. Do you take on speaking events for groups that want you to come out for an hour or two to talk about this?
We do. In fact, I'm working with several implant companies that are looking for ways to add value to their curriculum. I've got an engagement in Orange County this month. So we are working, anybody that is wanting that. This is kind of one of those things that adds value in all areas of dentistry because it's a message that's inclusive, not exclusive. So yes, we are willing to do that, work with people. Our goal is to reach doctors because if I can reach doctors, I know I can reach their patients, and those people really just deserve it. They're frustrated. I'd say the largest majority of people that we see have come back into dentistry, so it's not even like I'm robbing them from my neighbor. We're reactivating people into healthcare that have fallen out, and so it's awesome. It's a wonderful way to practice. It's very fulfilling, and so we let me just share this last thing. I had a doctor friend of mine who also holds educational courses, and he asked me, he says, all right, doc, what's your end game plan? Why are you doing this? And I know he was asking me from a monetary standpoint, how do I monetize what I'm doing? And the honest truth is I really don't know. I'm not great at, I don't know how to monetize this thing because my passion is educating. These patients are there, they're plentiful. It's a realm of dentistry that it's greater than anything else that we do in our practice on a day-to-day basis. And our doctors really deserve to have clarity in this area instead of just confusion. And unfortunately, we come out of school really unclear on how to help these patients. And I think a big part of it has been that missing link between the systemic acid and the inflammatory problems that are adding to the dental issues. And so education really is my end game. So awesome. However we can do that, obviously we hold courses. I guess that's part of my end game is just being able to educate doctors. That's one of the few ways that we monetize it. But I feel like we give that information away, but we do have to cover our costs on tuition. But yeah, so absolutely. And in fact, they can reach out to me. I'm happy to give out our number. They could contact myself or Lori, who handles all of my scheduling for those events at 928-776-0239. So if they want to reach out, if they have needs or would like, to add value to what they're doing, we can help with that.
Perfect. And if you're driving, please don't make an attempt to write that down. Get to your destination safely. We will post that
post
number.
It on the site.
Yes, we'll post the number. We'll post the website, and then the promotional code all on the show notes. So take a look at that when you're safely seated somewhere. Dr. Campbell, thank you so much. There's so much more we can talk about today, but we really appreciate you taking a full hour with us and sharing all of this valuable information. We appreciate you. And I think I have a candidate or two for people that would want you to come out and speak because I've never heard of this before. And Jordan and I interview people even outside of the podcast every day. And this is exciting to me because I mean, for you, Dr. Campbell, this is a personal issue with you mentioning that, you suffer from some of these things personally, and it's in your family. And so it means a lot to you to where I think our listeners could appreciate that the information, the valuable information that you shared here and in your courses is definitely something that adds value to people's lives, not just the practice and what people want to earn from a business perspective. But I'm a big believer that if you do the right thing by people you serve, the money will come. It doesn't necessarily have to be a focus up front. But for those of you that do take the course and are still wondering how to bill insurance, just give me a call, and we'll show you exactly what you need to do there to make sure that you do get compensated. The quality of the work that you do is being paid for adequately, and you understand the insurance components to the information that Dr. Campbell shared with us. But Dr. Campbell, again, thank you so much. It was a pleasure having you. We really appreciate you.
Guys, it's been awesome. And just real quick, I want to just tell you guys thanks for what you're doing. I love your podcast, Ben. As you know, I've used you in the past. We have this moment, and Jordan as well. Your product is something that we're looking at just really to add value to our patients on a day-to-day basis, and get them access to care, which is sometimes hard for people. So keep up the good work, guys. We appreciate you out here. I love your podcast.
Thank you so much,
Thanks,
Dr. Campbell. Have a good night, and have a good dinner, and say hello to the family.
Yeah.
Take care. I'll be talking to you soon.
Thank you.
Yep, we'll see you.
And that's it, folks. We'd like to thank you, the listener, for making this podcast happen. We are a young podcast, but we are growing at a fast rate. In 3 months alone, we've captured over 20,000 listeners, and our support is growing day by day. One way that you can show your support for our podcast is to simply tell a friend about us. If there is an episode that you enjoyed, feel free to share it. Also, if there is a certain insurance-related topic that we haven't covered just yet, we'd love to hear about that. Please email us and send us a request at help@veritasdentalresources.com. Veritas is spelled V as in Victor, E-R-I-T as in Tom, A-S. help@veritasdentalresources.com, and we'll make sure to include that request in our next and future episodes. Again, thank you for your support, and we wish you the best of success.